Dr. Sunil Kutty. I'm a consultant brain and spine surgeon working at Apollo Hospitals, Navi Mumbai. Today I'm here to discuss with you a very important topic, spondylosis. A topic which we all talk about. It's something, a term which is there in during common talk. So even when you're sitting with a friend, there is a discussion which comes up about spondylosis and how it is bothering you. So many a times patients who come to me with spondylosis come with their diagnosis. So they, instead of telling me their problem, they come and tell me that they have spondylosis. So what exactly is spondylosis and how does it really affect us is something which we need to understand. So spondylosis primarily means aging of the spine, the changes that come with aging. So if you look at the skin, it wrinkles in due course. So the skin that I had as a child, I no more have it. So there are things that keep changing. The hair that we used to have, the hair starts graying after a while. So similarly, the spine which houses the spinal cord within it, the spine also starts undergoing changes within it, and that is called spondylosis. So how does it bring about symptoms? It brings about symptoms primarily in two ways. One would be because structural changes that it undergoes, the extra bony prominence that come up, those things, these bony prominences which come out as called spurs, spondylotic spurs, and along with that there is soft tissue deformation also happening inside the spinal canal or around the spine. These deformations tend to impinge on the nerve roots or impinge on the spinal cord, which it is supposed to protect primarily. So the symptoms come out primarily because of the compression of these nerve roots or compression of the spinal cord that happens because of this unwanted growth that happens. So what could be the symptom that would come up? So depending on the nerve that is pinched. So if you're talking about a cervical spine and cervical spondylosis, which is very common, so the pain would be typically a radiculopathy along a particular nerve root. So that's the typical pain. If that persists for a long time and if the nerve root is getting compressed to an extent to which its function is being hampered, then the symptom would be a weakness of those muscles. So you could have weakness in your grip, you could have weakness in your flexion of the arm or the extension of the arm. So the hands could get weak in due course. That is one aspect of spondylosis. The other thing is the same process. When it occurs in the central portion, it starts compressing your spinal cord. So once it starts compressing your spinal cord, it's like the entire information highway that supplies the information from the brain to your limbs is hampered. So you could have symptoms all along, right, in the upper limb as well as the lower limb, including your balance and walk. So spondylosis, though by itself could be called benign, it depends on the direction in which spondylosis, the process extends. So if I could see an MRI or a CT scan with extensive spondylotic spurs, but all anteriorly placed or away from the spinal canal and the spinal, the patient could be absolutely asymptomatic, while a small bony spur which is impinging on a nerve root could give rise to severe symptoms. So spondylosis per se does not cause any symptoms, but depending on what it compresses, it could eventually lead to a lot of problems, and that is where our role comes in. So what do we do? The important thing is to diagnose the fact that we have spondylosis and diagnose along with that which particular part is being affected. That is also equally important. So MRI is an excellent investigation where we really need to take a call about what has to be done next, and we cannot do it without an MRI. If the symptoms are milder, just an X-ray and observation is usually, we keep the patient under clinical observation, that is usually good enough. If the compression is severe and if it is really bothering the patient, then we need to look at it further. That is where MRI comes into play. Not all spondylotic spines really need surgical intervention or medical treatment also, but some which cause symptoms and which cause symptoms which are severe enough to make the routine life of the patient difficult, that is where treatment is definitely indicated. So how do we delay spondylosis? And so we cannot stop spondylosis from occurring, but definitely it can be delayed. And so the key would be regular exercise, proper posture. So if you maintain proper posture and regular exercise, your weight distribution is so much better. So the spondylotic changes would occur or would happen in a much more delayed manner. Plus, once the symptoms are there, before it leads into permanent deficits, very important that you meet a doctor, consult him and understand what the problem really is and try and solve it at the initial stages rather than to wait till the very end where somebody cannot move the limbs properly or the deficits are profound. So then the recovery would be that much poorer. So the take-home message would be, what do we do about spondylosis finally? So spondylosis is something which can be delayed. How do we delay it? We can delay it by proper diet, regular exercise for your back, primarily your neck and your lower back, and good posture. So what good posture does is it distributes your weight so much better. The changes that happen because of spondylosis, those changes get delayed, and since the changes get delayed, the compression which a spondylotic spur would eventually cause would also get delayed. Thus your symptoms would obviously get delayed. So that's one particular aspect of prevention of spondylosis. Apart from that, if unfortunately you start developing symptoms which could be ascribed to spondylosis, which we've already described, then in this case it becomes extremely important to take necessary help at the earliest. So it would be good to meet a neurosurgeon before the symptoms become far too severe and irreversible. So the take home would be prevent it. If you can't prevent it, prevent further damage. Thank you so much.